Neuropathy is an outcome. It's an effect. It's not a cause. The question that you may ask yourself is, what conditions attracted my neuropathy? It is essential when treating neuropathy that you look at your lifestyle. You have to look at what you eat, where you live, where you work, what medications you're taking, and what stresses you are under. The main thing to realize here is that you are the difference. Now, while a course of treatment in our office involves many different aspects, perhaps the most important aspect is the understanding of the mechanism of causation. How did this actually happen for you? How did you develop this neuropathy? We must first understand that inflammation is a normal and necessary process that our body relies upon in order to maintain health. So when we have the inflammation process, there's a delicate, coordinated series of reactions in our immune system that actually involves a chemical messenger called cytokines. So we can go into this for days and days and days, but we're going to break it down a little bit and try and summarize it so it's a little bit easier to understand. Now, without inflammation, we would surely succumb to some of the slightest infections and health would not be possible. Inflammation also helps us to handle the healing process after an injury. It's there as a protective mechanism. And one of the most common areas of the body to fall under attack in the nervous system, leading to symptoms of neuropathy. Now, inflammation is the common thread that drives most of the chronic health problems that we see in the industrialized world. Heart disease, cancer, arthritis, diabetes, Alzheimer's, and neuropathy, but to name a few. Neuropathy, diet, and stress. Well, poor diet, chronic stress, and poor blood sugar control are going to cause inflammation. It's not unusual for patients to be dealing with multiple issues at the same time. For instance, a patient that has high levels of inflammation and burning neuropathy in their hands or their feet may also have a chronic subclinical infection. They might have poor blood sugar level control, chronic stress, and perhaps a poor diet as well. So we've got to look at all of these factors coming together. Because generally when you have one of them, you don't just have one. You're going to have a multitude of different things happening. So if all of these are causing the patient's inflammation and their neuropathy, do you see how futile it would be just to go and take a pill like Lyrica or Neurontin? How this one pill that's going to be treating just your neuropathy part of it is not going to fix the rest of the problem, because there's a lot of different things there. So if you do not address the cause of the inflammation, then you're never going to find the proper solution for you. Leaky gut syndrome. Now, much of inflammation is in the gut. And by gut, we mean digestive tract. We mean your stomach, your small intestines, and your gallbladder. Now, inside your gut lives 75 to 80% of your immune system. So if that goes bad, then your immune system is going to go bad. So every time that you eat food you're sensitive to, you're creating more inflammation and more immune system balance. So let's take a look at that a little bit. So what we see here are a little bit of a look into what the inside of the gut looks like. These are what we call villi, so intestinal villi. And then what we're going to have here this here is where we have food coming in. So food is going to get digested, and as the food gets digested, we are going to see the actual nutrients coming down and being absorbed. So those nutrients are going to be absorbed down here. These little finger-like projections, they're very tight here. Everything is tight. It's called tight junctions. So when you have tight junctions, that's a good thing. But sometimes we have a big gap here. And when we have this big gap, that's going to allow the food particles, so if we have a food particle, the actual food particle can get down through that tight junction, and that is what ends up being leaky gut. So as that food gets through there, any food that's not digested properly can actually rot in your stomach and cause a lot of problems in your gut. And then if your gut is not working at 100%, then you're not going to be able to heal properly. So that's why we see such a huge correlation between gut function and our health, or our body's ability to heal itself. So that's very, very important. Now, this commonly, like we said, leads to leaky gut. A healthy gut that we see here is a tightly woven, right here, that's tightly woven, okay? So it's going to prevent parasites or large undigested particles. Now, the only way to rectify this is to test for food sensitivities and to remove the foods that you are sensitive to, and then we have to heal the damaged gut. We're not just going to hope for the best, we actually want to heal that so that we can eliminate these problems here with the leaky gut, and we can get, with the proper intestinal flora, get that tight junction back so that the food particles aren't going to be able to get through there, nor the parasites. Now, these are not tests that are routinely ordered in most of your doctor's offices, but they are things here that we look at because we're looking at that intestinal permeability as an important factor for your gut function. Now, blood sugar level. Glucose or sugar is the body's main source of energy. It's transported all over the body in the bloodstream. Now, to help move the glucose along in the cells, what we see is a specific hormone. And in order for the glucose to be transported, let's just take a look here. We'll draw a little truck here. So this transport truck is going to be insulin. So this insulin is going to take the actual glucose and deliver it into the cells. Okay? So blood sugar is very much related to peripheral neuropathy, specifically in diabetic patients. The nerve cells themselves do not have this ability to have specific receptors for insulin. So what ends up happening is they have a process that's called diffusion. And what we see with diffusion is we have a molecule of higher concentration and a molecule of lower concentration. So where the molecules of a higher concentration move into the areas of lower concentration. But when the higher concentration of sugar in the blood causes the glucose to diffuse more, then what ends up happening is they end up pushing into the cells. When you get that pushing in, then that causes the damage to the cell, and then the nerve tissue actually degenerate and dies. So when we get too much of this diffusion going on here, that's going to damage the tissues. Okay? That's why it's very important to understand how peripheral neuropathy comes about from diabetes. Now, what's next? One of the conditions that precedes diabetes is insulin resistance. So it's not just a matter of being diabetic, but it's the ability to actually utilize this